Paul Griffin here, MARTA's Director of Infectious Diseases, here with my weekly update on COVID-19. And once again, I'm going to be able to start with some good news. We've seen the numbers of new cases continue to decline, including some days this week in Queensland where we've seen no new cases. This is definitely good news and really demonstrates the flattening of the curve that we've been wanting to get for some time. I'd like to caution people though to overcall this information. While it is really good news and evidence that everybody's doing the right thing, it's too early to look at releasing too many restrictions just yet. We have seen a step in the right direction with an expansion of elective surgery that's going to be implemented soon, but I think it's way too soon to look at more broadly relaxing these restrictions just yet. We need to keep up the good work for now. Another important point to remember during this time is it's really important to take care of your general health. If you have any pre-existing medical conditions, it's important to make sure they're managed as well as possible. And there are a number of other ways we can continue to stay healthy during this time, including looking after your diet and exercise, as well as your mental health, to ensure that you remain well while we continue to try and reduce the spread of COVID-19. And while we've seen many changes in the community, here at the MARTA we've seen some changes as well in terms of how we deliver healthcare. Increases in telehealth and some restrictions in access to our buildings while we make sure our staff as well as patients remain safe. I'd like to thank everybody for the efforts in upholding these restrictions and ensuring that this is in fact the case, that all of our staff as well as our patients are safe. But I also wanted to reassure everybody that if people do need healthcare, we are still open for business and would encourage people to attend as necessary. With all the good news we're hearing in terms of the reduction in new cases, the main question I'm getting asked now is when are we going to lift these restrictions? And while it is really good news the numbers of new cases have fallen, it is too soon to look at reducing the restrictions more broadly. Resumption of elective surgery is a good step in the right direction, but we need to keep up all these restrictions, keep up the social distancing and the hand hygiene. Another question I've been asked repeatedly is, should I wear a mask in the community? And the short answer there is there's not sufficient evidence to support the wearing of masks in the community. And once again, the measures that we're recommending, hand hygiene and social distancing, are the ones that are evidence-based, they're proven to work, and we're seeing the results of that. What we don't want to do is see people wear masks and think they're protected and compromise those other things. So keep doing what's recommended, and the use of masks can be something that we restrict for our healthcare workers who are working with people who are positive or suspected to be positive. In terms of how long SARS-CoV-2, the virus that causes COVID-19, can survive on surfaces, it's a bit of a difficult one to answer because it really depends on a number of factors. We think the worst case scenario is on surfaces that it likes, that are hard and shiny, such as metal surfaces, where it may be able to persist for even up to 3 or 4 days. The good news though is on skin, where we have a healthy microbiome to combat these sort of pathogens. It probably only survives 5 or 10 minutes. But again, in terms of surfaces and contamination, if we do our hand hygiene properly after touching any surface that could be potentially contaminated, we really take that out of the equation in terms of it being a risk of acquiring this virus. So once again, if you do your hand hygiene well, you'll stay protected. I think it's clear that our response to this pandemic has been very significant. And we're certainly all aware of the impact on people's day-to-day lives in terms of the social distancing and the isolation measures that we're all subjected to. But I guess the key message this week is that they're clearly working, and we're seeing the curve flatten not only here in Queensland and Australia, but really more broadly. So what we're doing is working. We know it's not easy, but it's continuing to have a significant impact. And if we can keep doing all the right things for a little while longer, hopefully the end is coming closer to being in sight. So keep up the good work.